But, the most important thing, so, when I do discovery calls for people, if they want to know if we're a good fit for them, if what they have I can help with and stuff like that. And the number one thing I focus on in that call is, look, we have to figure out what is causing your pain. I know you'll understand this, because if someone comes to you and says, doc, I'm tired all the time, just give me testosterone. And you go, well, wait, let's figure out if the testosterone is actually the cause of your fatigue. Because if it's not, it's gonna do nothing for you. And the same thing applies with chronic pain, right? If someone comes in and they've got back pain, even if they've had an MRI and the MRI shows a disc bulge, that may not be the cause of their pain. And more often than not, it's not the cause of their pain, right? It's a facet joint, or it's a side joint, or it's a small little nerve or a ligament. And so we just have to spend the time and the mental resources to figure out what that piece is. Even if I'm just going to do a peptide, because the flavors of peptides we're going to do for a disc issue is going to be different than if it is a ligament, which is going to be different than if it's a nerve, right? And so, because, when you look at the peptides for chronic pain, there's really only about 5 or 6 of them that are really helpful. And, sure, you could put everybody on all 6, but I like being a little more selective.
Yeah.
It's pretty expensive to do all 6 at once, I'll say that. And so, just always understanding what is the actual tissue level cause of pain. What tissue is the brain perceiving as painful? Because then when we go to intervene, we just have a much higher % chance of seeing success with treatment.